I'm a strong believer that the hospital should be serving its community, and that people shouldn't just come up to the hospital, but we need to deliver care closer to people where they live. And so this model in particular at Access Health here was opportunistic in terms of we knew this population were quite itinerant, and it was a drop-in service.
Because of where we are located, we have developed over the years a very strong connection with the local Aboriginal and Torres Strait Islander community, particularly those that are sleeping rough. By having the Diabetes Initiative based here physically at Access Health, it's just balancing out the inequities. I think we've still got a long way to go, but it's providing that slightly more even playing field for Aboriginal and Torres Strait Islander people to engage with quality healthcare.
When we're dealing with diabetes, we're in fact dealing with chronic disease. And so we don't just focus on diabetes in isolation. We have to address the patient as a whole and address their diet, their lifestyle, their weight, their activity. If we can address those issues, we're addressing their chronic disease and we're preventing diabetes, cardiovascular disease and kidney disease. And so this model in total has relevance across the spectrum.
For myself, as a diabetes educator, I would love to come more than one day. Getting the opportunity to talk about what exactly is diabetes, what do I do? If you think about it, going to the GP, you get 15, 20 minutes and you're paying, and this might not even come up. So the fact that they know, okay, there's an educator, okay, what do they do? Maybe let me go and have a chat about these issues that I'm having.
It's made a big difference for me and lots of other people here at this service. I don't have to go out to any other organisations to sit there all day waiting for something that can happen here and with a whole group of women. It's the workers here. They know how to deal with the people from off the street. I don't know how to deal with them, but they're more welcoming with them and bring them in. If there's anything wrong with them, they're more caring. It's easy for the people in this community to come along here and get themselves checked. I don't think they would otherwise go into a hospital.
The Diabetes Initiative is very personal to me because I've got type 2 diabetes. So if we're talking about First Peoples, they want to go to places where they don't feel like an alien, but welcome. And it is not rushed. It is about the cultural safety, of course, but you need to take into line about the economics. If they feel that staff are too busy for them, they're rushing around, no, won't come. So this is another added bonus here. People are leisurely, just go about their business, do it professionally, right from the reception staff to the clinical staff.
What would I do different about the AHIO program would probably be more outreach into the gathering places. We're looking at running some diabetes yarning circles, which is something we have started doing, and something that we're going to pursue as well, because once again, it's about prevention is best. It would be great to see some of the other specialist services extended within this clinic, whether it's psychiatry or cardiology. We go by what our patients want, and sometimes our priorities in care and what we think is most important may not be somebody else's. A lot of Melbourne community have gotten to know us over time. Their feedback is that they do enjoy coming here. They spend, they might come here to see one of us, but they will spend, half a day here, just getting that, everything, all their care here.
The gathering place is a space for Aboriginal and Torres Strait Islander community members can come for general drop-in, information, support or referral. But more to that, we also run programs and events from the gathering place.
I'm just one of the elders here and also included with the gardening group on Tuesdays. We just gather together and we just have a good yarn.
I normally come down to do family connections and do yarn and art with other elders and do the exercise group. The staff that have been coming in here in the time that I've been here are only too helpful. That has a lot to do with why these older ones in here keep coming back.
I think it's definitely a big step forward to bring healthcare to the doorstep of Aboriginal and Torres Strait Islander communities. Elders can engage in a way that is safe to them rather than having to navigate the mainstream health system on their own.